meeting with Ron Chenail. Ron is a professor at the University, Nova Southeastern University in Florida, and also a top-level administrator at Nova. But Ron, perhaps more importantly for purposes of our interview today, is the editor and is the current sitting editor of JMFT, and has been in that position for a good 4 or 5 years or longer.
Oh, actually, this is next year will be my final 7th year.
7th year, okay.
Yeah, time flies.
So I think as these interviews have gone, we're interested in knowing more about MFT and MFT research, and specifically would like to kind of tap your brain for where the field is going as far as research-based articles that comment on or that shed light on the practice of marriage and family therapy.
Okay. I guess I see us falling into 2 different areas in terms of the different type of paper. And let me preface, the first type is a very valuable type of work, but also journal editors like it because these articles get cited more. And those are the review articles. And
not just like meta-analyses?
You're right. So I break it into the narrative and the systematic. And so the narrative would be something that students would be familiar with, that maybe has a critical side to it, but it's more like reporting.
And here's what's being done in this topic area.
What differentiates that between the systematic is that you don't quite know the sampling and the review process that resulted in the articles being shared. So people mostly tell a story, and it could be very biased. They could have picked articles that just fit their perspective. And so those, you see maybe less of those, although we publish that kind. The one that you see more, it would be, if you looked at the effectiveness issue that's going to come out in 2011, a lot of those are narrative style, but they're very focused, and their focus is all on, it's a review of the research on a particular topic. So Sandy Stith and her group are doing the next iteration of the domestic violence one. The one that I do with my colleagues is a qualitative metasynthesis. And in there, it's a research study. We walk through what our research questions were. We wanted to know what was what can we learn about client experience research when clients are in conjoint therapy. There have been plenty of studies about individual clients, but nothing about conjoint. So you walk through your research question, you lay out your sampling strategy, inclusion, exclusion criteria. For example, do you include the Cray literature, dissertations, thesis, papers? And then you have a systematic way of analyzing it. In this case, we used a grounded theory style. We wanted to come up, is there a theory? Do we see things that vary? And so Carmen Knudsen-Martin, I think, did one of the first of those that it's either an early view right now, where she did a systematic review. So those are very popular, and I think they're very valuable for anyone that does work. For example, I like your article about when you did the review of their literature on case documentation, progress notes, and that. So those are the narrative style, and I use that. I cite that one all the time. But I think you're going to see more emerging of these systematic, and you see Shaddish's stuff, the quantitative meta-analysis. But there's a variety that include not just randomized controlled trials, but looking at, and I think the best evidence. The best evidence might be a case study. The best evidence might be a case series. The best evidence might be an ethnographic study. So you're seeing, especially out of medicine, some new methodologies that are looking to combine those things. Just like in ours, we combine generic, qualitative, grounded theory, ethnographic, and so forth, looking at themes across those pieces. So that's one area. The other area that I wish we could see more is that it always pains me, and I get focusing from a student. Every student that leaves a PhD, an MFT, COAMFTA, the program, and doesn't do something to help further our understanding of our way of clinical practicing, I think we've lost something. And a lot of programs are very, like our program in Nova is more like student-driven and what students want to study. And it's sort of that, well, why aren't you studying something that's, I would say, clinical, something in the clinic? We'd love to do sociological studies. Let me talk about the immigrant experience. Nothing wrong with that, but we're not suggesting that every immigrant is a clinical patient.
Right.
And the idea of that, and then jumping and saying, okay, so here's how we would treat them. Well, they're not in treatment. You didn't ask them about treatment, so how relevant is it for JMFT? And I direct those papers elsewhere.
Yeah, so you're making quite a leap with that argument. Yeah.
Right. There's really no evidence. It's beyond the data. You're going beyond it. So, so I like a variety of. Maybe also a page out of the American Psychological Association is methodological plurality. And it's really a good, strong clinical question and a nice fit with the methodologies appropriate, and furthers our understanding and challenges our understanding. You know, sometimes it was seen that postmodern therapies, they study a particular way, their work, and then you have the empirically supported types the other way. I'm seeing that changing a lot right now. Just did a study for Tom Strong and his colleagues up in Canada, and we reviewed the literature on collaborative language, solution-focused, and narrative. And solution-focused is starting to look like an empirically supported, and Sandra Smock's work suggests that.
Yeah, Sarah Smock.
Yeah, and then you're seeing the first manualized narrative therapy study just was published out of Australia. So you have solution focus has a manual, narrative therapy. So solution focus is much more diverse in terms of the traditional case study, to qualitative all the way through to you're starting to see more controlled studies. And then you're seeing narratives moving in that direction. I'm not sure if the death of Michael White made a difference because he certainly had a particular view about how that would work, but if you look at his book Maps, it's a manual for narrative therapy. Collaborative language is not as far along in that process. So I'd like to see that and encourage people to blur that difference and to, if your question is a particular question. Bottom line is this: when you look at all the reviews of marriage and family therapy, the best we can usually say is our treatment has been shown to be better than nothing. And so,
Yay.
right, and so that's a real challenge, and it's difficult for a student because of funding and so forth.
Right.
But always the criticisms are the same. There's bias to the work because you're studying your own group.
Right.
There's a small sample size, and we're not taking what is the state of the art in terms of treating with a particular problem. Now you're seeing this change. Narrative therapy, you're seeing more studies saying we're starting to think that that's emerging as a preferred practice with older people with depression. A body of research is emerging in that area. So I think encourage students to kind of pick somewhere along the developmental line. Doing a review of that literature on narrative therapy with depression will help set up that next step, and it might be even in their own research. So
And point to the next study. Here's the logical conclusion from what we know and what we don't know.
Right, so
Where we need to go.
process research is great, outcome research is great, learning more about the experience of the participants, both client and therapist and supervisor. There's so many places that you can kind of plug in and find your niche in these ongoing lines of inquiry. But that's, to me, the most frustrating part, is that I don't get enough of those kinds of papers that are sort of the sweet spot of our field, really challenging what is it about using a relational approach of working with people with these particular